It's really rewarding when we're able to uncover some new science that leads us to those innovations that we wouldn't have ever thought of before. I really love working in areas where we can potentially deliver innovative solutions to pets and our pet owners. Hi, I'm Andrea Gonzales. I'm the Vice President of Global Companion Animal Therapeutics at Zoetis. One of my proudest moments was to be part of the dermatology teams that delivered Apoquel and Cytopoint. And I think what was so rewarding was because we discovered some new science there around what was playing a role or what was triggering allergic skin disease in the animals, and we used that science to develop the best therapy that delivered a very effective and safe therapy, two therapies to pet owners and their pets. So I've had 3 dogs over my lifetime that have struggled with skin allergies, and I had one dog, Piper, that was extremely bad. She was very itchy, her skin was pink, it was easy to see. She was a light-haired colored dog, and she was just so uncomfortable. She couldn't relax, she was agitated all the time, and again scratching all the time. So we knew she probably had allergies, and we went to the veterinarian, and he of course diagnosed her with allergic skin disease. So we got our bottle of Apoquel, and when we got home and I gave her her first pill, it was amazing. It was within an hour she quieted down, she stopped scratching, and she could really relax and just take a nap for a couple of hours, whereas she hadn't been able to before. So that quality of life just really improved, and that was just a very rewarding observation for me to see with my own dog, because of course we were generating all kinds of data to tell us that Apoquel worked very quickly to reduce itch, but it's another thing to see it in your own dog when you recognize how much they're suffering and how poor their quality of life is. So it was very striking to me to see it in my own dog, to see Apoquel work so effectively. I worked in areas of oncology, toxicology, inflammation, and meanwhile, while I was there, I was also working with scientists from animal health, because many of the diseases that we get as humans, animals can also get. It was really fascinating to understand the different diseases that dogs and cats can get, and even horses, and thought, I would love the opportunity to try to find new therapeutics for companion animals. One of the aha moments we had with the Apoquel program was when we were still running our clinical trials, and the clinicians were having no problem enrolling patients into the trials, and then we started to get the letters back from the pet owners describing how their dogs were suffering from allergies over so many years. No treatments were working for them, and then they enrolled onto this clinical trial, and all of a sudden they had their dog back. What's really rewarding for me is when we run across an obstacle. We have great teams with people with a lot of different expertises coming together, and we really can brainstorm and try to figure out how we can overcome that obstacle. And it's really exciting to see when a team can come together, and I think we come out with a better idea collectively as a team than what each one of us individually came in with. That's so rewarding to me. We really spent a lot of time understanding how that molecule worked, and we really had some thoughtful data-driven decisions on how we were going to pick that dose to maximize efficacy and minimize any safety risks. So our group has all kinds of ideas that they love to explore. Some of the ideas that we're working on right now, we are interested in understanding allergic skin disease in other species, We've had a lot of success in the canine area and understanding pathophysiology of the disease and what are the right treatments to bring forward for dogs. But we still need to continue our research in other species. We're very interested in treating allergic skin diseases in cats and horses and continuing to learn a bit more of what the disease is like in those species. We know we have a lot to learn in cats, and there's a lot of other innovations we could bring forward.